Hi, my name is Michelle Loyola. I am part of Nightingale College, BSN 246-04. I am going to be demonstrating an IV insertion and peripheral IV discontinuation. I have no nail polish, no jewelry, badge intact, and with my uniform. I have my patient here, the forearm. I have normal saline, 10 cc's. I have the catheter IV that is 22 gauge, 1 inch. And then I have my IV kit. I have my 12-inch IV extension kit, 2 pairs of clean gloves. I have the gauze and I just need the tape for the discontinuation, and then imaginary sharps container. From here, I'm going to be back gathering my supplies. I will review the physician's orders. This patient, Mr. Smith, is a 71-year-old male who presents with needing rehydration. I am going to gather my supplies, either place it on a Mayo table. If there is no Mayo table in sight, I will gather my supplies, put it in the patient's room on a flat, clean surface. I'm going to proceed to the patient's room, knock on the door. Before knocking on the door, I'm going to wash my hands before entering the room, knock on the patient's door, close the door or close the curtain for privacy purposes, place the supplies on a flat, clean surface, or have brought in my Mayo table with the supplies. Again, perform hand hygiene, get my gloves, introduce myself. Hello, Mr. Smith. My name is Michelle. I am your nurse working with you today, and demonstrate or inform the patient of what instructions I have been given. So the doctor has ordered an IV insertion for rehydration. And from here, I am going to ask for your name and date of birth. Patient's name is Mr. Smith, January 2, 1954. I am going to get my supplies. In the meantime, I am informing the patient what I am doing. So I am going to get this normal saline first, prime the IV. Remove the caps, attach the extension to the normal saline, and then from here I am going to prime it at least 2 drops. From here I am going to clamp the IV, not recap it, pull it aside. And then from here, I am going to get my IV kit, open my IV kit, and from here, I am going to, the first thing I'm going to get is the tourniquet. And the tourniquet, I am going to apply to the patient's arm at least 4 to 6 inches from the insertion site, slightly tight until I see the vein. From here, I am going to get the alcohol prep. I'm going to clean the site from inside going out. From here, I am going to get my IV, that is 22 gauge. Make sure that the bevel is up. From here, I am going to taut or stretch the patient's skin at least 1 to 2 inches from the insertion site. I'm gonna, with the bevel up, I'm going to insert the IV at least 45 degrees. From there, I do see a flashback. The flashback, I will advance the IV catheter, the needle a little bit more, and then advance the IV catheter. No more advancing the needle. And then from here, I am going to click on the white button here for safety as it retracts back. From here, I am going to put it inside the sharps container. And then I am going to remove the tourniquet. I am going to apply the extension part of the normal saline, unclamp it, attach it to the IV catheter. From here, I'm going to aspirate the IV to check if the IV is working. No infiltration, no discoloration noted. And then I'm going to advance slowly the IV flush at least 10 cc's. I will inform the patient they will feel a little bit of coldness. Sometimes they will also taste it. Remove the, I'm going to clamp it, remove the extension. From here, I am going to apply the tape. Apply the tape above the IV insertion site, not directly on top of the IV. And then I will also at the end of the tape, I am going to put my initials, date, time, size of the IV, and the needle. I am going to apply it on and attach the IV extension. I am also going to apply more tape just to keep it secure. Alrighty. Okay, Mr. Smith, I am going to gather all my supplies, discard everything, including my gloves. Ask Mr. Smith, is there anything else I can do for you? I am going to follow up with you as your IV hydration is going. I'm going to exit the patient's room, give the patient privacy, close the door, close the curtain. wash my hands, document my IV insertion, and then time has passed. From there, I am going to, I received a physician's order to discontinue the IV. I am going to discontinue the IV with the gauze and tape. I'm going to wash my hands before entering the room and knock on the patient's door. Hello, I am Michelle, your nurse again. I am going to discontinue your peripheral IV per the physician's orders. And go ahead and do that. So I'm going to slowly remove the tape from the patient's skin. As I am removing the tape, I am also still holding onto the IV catheter to keep it in place. And then from there, I am getting a gauze, applying it on top of the insertion site, not directly on top yet, until I slightly slide the IV completely out of the patient's insertion site, and then apply. From there, I am going to check for if the catheter is intact. Make sure I document that it is still intact, no infiltration noted. From here, I am going to apply pressure for at least 30 seconds. Inform the patient I am going to apply for at least 30 seconds. I do not see any more bleeding, and I'm going to gather another new pair of gauze and apply it back on the patient. And then tape. From here, tape it. Right after I remove the IV catheter, it goes directly inside the sharps container, by the way. And during that entire process, I did have gloves on. From there, I am going to remove my gloves, wash my hands, and ask the patient, is there anything else I can do for you? Make sure the call light is within reach. And then